The early adopter offered us a really good opportunity to focus on maternity services, delivering kinder, more personalised care to women and families across our population.
There was a recognition that within Surrey Heartlands we had 3 average-sized maternity district general hospitals with maternity services, and to enable providing services differently, we were going to have to come together and work collaboratively. So over the last 2 years we've been working on 4 work streams, one of them around improving access to women for expert advice. We have successfully implemented a community hub in one area with plans in progress, implementation plans in progress for 2 others. A full range of community midwifery services will be provided in the community hubs, working alongside perinatal mental health providers to improve provision of support for women antenatally and postnatally, perinatal mental health. We are setting up the hubs with the capacity to bring in additional providers.
Women have clearly said that they wanted to have a different kind of maternity service. They wanted to be more involved with the planning, and also as well they wanted to know the midwives. They wanted to have some continuity about who was caring for them. We turned it round and made it very clear that 100% of women should have continuity antenatally and postnatally, and our starting point was to give 20% of women continuity for their birth period as well.
And I'd met them all prior to giving birth, so I knew that the day that I went into labour, which could have been any day, it wouldn't matter who was on call.
We recognise the need for change in terms of the digital agenda, in line with the national picture, and recognising that we all wanted to move towards having electronic and digital maternity records. And certainly looking at our Surrey Heartlands Pregnancy Advice Line, it allowed us to then be able to access women's notes in real time and then be able to amend those. So then if the woman needed to be referred into hospital, by the time she actually got to the hospital, that information was already accessible digitally. All information leaflets, rather than being in paper form, they actually have access to those on their portal. And it just means, again, not having to repeat their story each time they meet another health professional.
In the ambulance service, midwifery is it's a challenge for any clinician when they're going into somebody's home. Mums and expectant mums have got a number they can contact. It's 24/7, it's there. Every single staff member said the benefit they felt and the confidence it's brought into the service is unbelievable. It's a model that we're sharing across all of our clinical expertise now, and something we've taken out.